RAMIZ BRAHIMAJ ear injury. UFC Fight Night, Santos versus Teixeira.
Bro, what are you talking about, man?
Today I'm talking about the injury suffered by RAMIZ BRAHIMAJ at the UFC Fight Night, Santos versus Teixeira. So be sure to lend me your ear and listen up. RAMIZ BRAHIMAJ was scheduled to fight Max Griffin in a welterweight matchup on the undercard of the UFC Fight Night on November 7th of 2020. Griffin entered the fight as a striker with a 15-8 record. BRAHIMAJ, on the other hand, entered as a submission specialist with a record of 8-2, having finished the majority of his fights by submission. The fight was scheduled for 3 rounds and it was likely to be finished by either a knockout by Griffin or a submission by BRAHIMAJ. Despite these predictions, neither of these outcomes happened as the fight went well into the 3rd round before it was stopped by TKO. In this video, I'm going to talk about why the fight was stopped, what injury occurred, and how this injury will be treated.
Ladies and gentlemen, can I please have your attention?
Hey everybody, Dr. Chris, orthopedic surgeon and sports medicine physician. If you want to learn who I am and why you should subscribe to this channel, then stick around to the end of the video. Otherwise, let's get right to it. The first round of the fight proceeded with Griffin working to establish striking distance with BRAHIMAJ. Griffin circled to the right throughout the round and peppered BRAHIMAJ with jabs while BRAHIMAJ looked for opportunities to take Griffin to the canvas with a takedown. The first round ended with neither fighter taking much damage, but with Griffin with the slight advantage. In the second round, however, Griffin, having found striking distance, began to turn the heat up. Griffin continued to confuse BRAHIMAJ during the fight, preventing him from attempting a takedown. BRAHIMAJ's face began to show some wear into the second round. By the end of the round, it became clear that BRAHIMAJ did not have a solution for Griffin's movement and his accuracy. Although he had managed to strike Griffin with a few heavy blows and even open a cut on Griffin's brow, BRAHIMAJ was not able to capitalize on these interactions and left the second round with a considerable scoring deficit. The third round started much the same as the second round had ended. Just past the midway point of the third round, however, the two fighters clinched against the fence. Griffin controlled BRAHIMAJ using his left arm and his body weight, leaving his right arm open for strikes. Just prior to the stoppage, Griffin struck BRAHIMAJ with a right hand and then in the clinch with a short right elbow. BRAHIMAJ, although battered, did not look to be stunned, but the referee stepped in to stop the fight. It was not immediately clear until the fighters separated from each other what had prompted the stoppage from the referee, Mark Smith. As the fighters backed away from each other, the announcer's commentary drew immediate attention to the gruesome injury that had occurred. As the cameraman became aware and focused in on it, the injury was even more apparent. And despite the noise of the octagon, the reason for the stoppage was clearly heard by all, except possibly RAMIZ. So why had Mark Smith stopped the fight? Shortly after the fighters separated, it became clear what Smith had seen that caused him to stop the contest. BRAHIMAJ had been struck by Griffin's elbow directly above his left ear. This resulted in a partially amputated left ear, which appeared to be barely, and I do mean barely, hanging on from its lower aspect or bottom half. BRAHIMAJ did not appear to be immediately aware of the severity of the injury. Eventually, as it hung away from his head, he seemed to grasp the degree of damage and he used his left hand to hold his ear close to his head, essentially preventing it from becoming fully avulsed from or ripped off of his skull. So what is the injury that BRAHIMAJ suffered? A partial amputation of the ear is known as a partial auricular avulsion. It is a type of complex ear laceration. It occurs when a portion of the external ear, or pinna, is separated from the skull by disruption of the skin and cartilage that normally connect the external and internal structures of the ear. Unfortunately, the ear is susceptible to injury as a result of its prominent position directly overlying a bony surface. These injuries are challenging due to the limited blood supply to the ear and the complex nature of the involved structures. Generally, ear lacerations occur on the skin-covered cartilage that forms the bulk of the external ear. The cartilage of the auricle is continuous to the cartilage of the external auditory canal. This means that the ear is attached to the skull by both cartilage and skin. While the skin of the ear is vascularized or supplied by blood vessels, the cartilage itself is not, instead receiving its blood supply from the perichondrium, the connective tissue that covers the cartilage. The nerve supply of the ear is more complicated, with the ear being innervated by branches of the trigeminal nerve, the lesser occipital and greater auricular nerves, the vagus nerve, the facial nerve, and the glossopharyngeal nerve. Since there are not any bones that extend from the body into the ear, there are only soft tissue structures connecting it to the rest of the body. Consequently, it is relatively easy to separate the ear from the head if it is struck at the right spot.
Okay.
Or in the right way. Not that anyone would actually want to do that, but just saying. So, how should this injury be treated? Obviously, this injury is a surgical emergency. It is important for the ear to be repaired urgently to avoid complications, especially if the auricular cartilage is exposed. Although minor auricular avulsions can be repaired by an emergency physician, more severe injuries such as Brahimaj should be referred to a plastic surgeon or an ear, nose, and throat specialist for repair. Generally, the threshold for referral to these specialists should be low. This is especially true if the patient has an auricular avulsion, a laceration that extends into the external auditory canal, a laceration concurrent with a basal skull fracture, or a laceration associated with internal or middle ear damage. Complications that may arise from this injury include infection, chondritis or inflammation of the cartilage, necrosis or tissue death, or persistent deformities such as cauliflower ear. In Brahimaj's case, he will receive tetanus toxoid if his status is not up to date and antibiotics to avoid infection. He will then undergo an irrigation and debridement where the wound is washed with sterile saline fluid and all dirt and contaminants removed from the zone of injury. After administration of appropriate anesthetics, the repair will be performed. There are two major principles for repairing complex ear lacerations. The cartilage must be properly realigned during the repair to, number one, maintain the normal aesthetics, and number two, to ensure adequate coverage of the cartilage so that it can receive its blood supply. It is also important to apply pressure to the ear once repaired to avoid the formation of a hematoma or collection of blood and subsequent cauliflower ear. A poorly repaired ear laceration can lead to hematoma formation, nerve damage, flap necrosis, or irreversible asymmetry. So clearly, this should be avoided. If you know of another athlete or entertainer who has suffered a similar injury, let me know in the comment section below. Those of you who have seen my older videos, you know what I'm talking about. If you are here because you recently subscribed to my channel, then thank you for becoming a part of the Intern Army. Now at 60,000 and marching towards 70,000 strong. Welcome to my channel where I explain orthopedics, sports injuries in a way that's easy to understand for everybody. If you're interested in sports injuries and how they happen, then stick around. So subscribe and hit the notification bell so that you won't miss any of my content. And be sure to tag a student who is interested in medical topics. Follow me on Instagram or Twitter for medical stories and content, TikTok for info on medical education, and on my other YouTube channels for my podcast or for workouts and training tips. Thanks for watching, and as always, that's been a word from Dr. Chris, not your everyday ortho.
Just a flesh wound.